A 60-year-old patient is admitted with acute pancreatitis. The nurse would expect which of the following lab findings? Correct answer is option C, increased serum lipase. Which of the following is the priority assessment for a patient who is post-laparotomy for bowel resection and is complaining of pain? Correct answer is option A, vital signs. A nurse is assessing a patient after a cholecystectomy. Which complication should the nurse monitor for most closely? Correct answer is option C, hemorrhage. Which of the following findings is most consistent with an early sign of hypovolemic shock? Correct answer is option C, tachycardia. Which of the following is the most common cause of hypovolemic shock in a trauma patient? Correct answer is option B, hemorrhage. The nurse is assessing a client with a suspected stroke. Which of the following is the most important to assess? Correct answer is option C, Glasgow Coma Scale score. A nurse is caring for a patient with a history of gastric ulcer. Which of the following foods should the nurse encourage the patient to avoid? Correct answer is option C, coffee. A patient with chronic kidney disease is prescribed erythropoietin. What is the nurse priority assessment? Correct answer is option A, hemoglobin levels. A nurse is caring for a patient with hypothyroidism. Which of the following is a common symptom? Correct answer is option C, cold intolerance. A patient with a history of asthma has a peak flow meter reading in the yellow zone. What should the nurse recommend? Correct answer is option C, use a short-acting beta agonist. A patient post-cholecystectomy is experiencing pain in the right upper quadrant. What is the nurse's most likely intervention? Correct answer is option B, assess for signs of infection. A nurse is caring for a patient with a gastric ulcer. Which medication should the nurse expect to be prescribed? Correct answer is option B, proton pump inhibitors. A patient with heart failure is experiencing SOB and crackles in the lungs. What is the nurse priority action? Correct answer is option C, elevate the head of the bed. A patient receiving IV vancomycin develops a rash and hypotension. What should the nurse do first? Correct answer is option A, stop the infusion. A patient with pneumonia is receiving antibiotics. Which of the following signs indicates the treatment is effective? Correct answer is option B, decreased temperature. A patient is being treated for hypertension with a calcium channel blocker. Which side effect should the nurse monitor for? Correct answer is option B, peripheral edema. A post-surgical patient develops a fever of 101 Fahrenheit. What is the nurse priority action? Correct answer is option D, assess for surgical site infection. A patient with diabetes present with a fruity odor on their breath. What is the nurse priority concern? Correct answer is option B, diabetic ketoacidosis. A patient who had a stroke has difficulty swallowing. What is the priority intervention? Correct answer is option A. Assess for dysphagia. A patient is diagnosed with acute renal failure. What laboratory result is the nurse most concerned about? Correct answer is option A. Elevated creatinine. A patient is post-operative and reports pain rated 8 over 10. What is the nurse priority action? Correct answer is option C. Administer prescribed analgesic. A patient with a history of stroke has weakness on one side. What is the nurse priority assessment? Correct answer is option B. Motor function. A patient post-MI is prescribed nitroglycerin. What should the nurse monitor for? Correct answer is option A. Hypotension. A patient with pneumonia is receiving oxygen. Which of the following findings would require immediate intervention? Correct answer is option B. Cyanosis of the lips. A nurse is caring for a patient with cirrhosis. Which of the following is most important to assess? Correct answer is option D. Abdominal girth. A patient is on warfarin therapy. Which laboratory value is most important to monitor? Correct answer is option B. INR. A nurse is caring for a patient post-hemorrhoidectomy. Which of the following interventions should be included in the care plan? Correct answer is option A. Encourage high fiber diet. A client with chronic kidney disease is experiencing dyspnea and has crackles in the lungs. What is the priority intervention? Correct answer is option B. Administer a diuretic. Which of the following findings is consistent with a diagnosis of acute renal failure? Correct answer is option C. A nurse is caring for a patient with end-stage liver disease who develops confusion, lethargy, and astrax. What is the most likely cause of these symptoms? Correct answer is option A.